Injury of the fibular nerve at the level of the fibular neck. That was the result of the electroneuromyography that my patient showed me today at the office. So, do you know what the best treatment is for fibular nerve compression? That's what we're going to talk about in this video today. The main symptoms of someone with a compressed fibular nerve are as follows. Foot drop itself, meaning loss of strength to lift and extend the toes, tingling on the top of the foot and the lateral part of the leg. In addition, there is weakness when walking, frequent tripping, and also difficulty keeping your shoe or sandal on. If you suffer from these symptoms, you may have a compression of the fibular nerve. Identifying the cause is extremely important. Among the main causes of fibular nerve compression, we have prolonged pressure on the knees, such as when you work kneeling down like a kindergarten teacher, or sitting with your legs crossed for a long time at the computer, or even because you wore a compression stocking in the area of the fibular nerve and it ended up squeezing your nerve. Other common causes seen in the clinic are knee surgeries, fractures and ligament injuries of the knee, and also very rapid weight loss. Have you ever heard of a patient who had bariatric surgery and after a few months started to lose strength in their foot? Well, that can happen. That's why it's extremely important to identify the cause of the compression of the fibular nerve, because once we know the cause, we can discuss the most appropriate treatments for this problem. The best initial treatment is to reduce the cause. For example, if you are wearing a cast that is pressing on the nerve area, or a compression stocking that is squeezing the nerve, or if you often sit with your legs crossed, stop immediately. By reducing or eliminating the cause from your daily routine, you have a chance to improve without needing surgery. However, if your fibular nerve injury occurred after surgery or was caused by compression from an accident, then the situation is different. We need to understand how severe your injury is, mainly through electromyography, which is that test with small electric shocks, and it should be performed 30 days after the accident or the surgery you had. This test will show whether or not there are signs of reinnervation of the fibular nerve. If there are no signs and time goes by without any improvement in your movement, you may be a candidate for surgery. Normally, we perform this surgery between 3 and 6 months after the accident or the cause of the injury. If you have a nerve tumor or a neuroma, then surgery is performed earlier. If this video helped you and you want to know more about fibular nerve surgery, click here on the card. It's the topic of our next video. If you enjoyed the content, follow our channel.